because we are tackling mainly the perspective of body image in this episode that we want to share and talk about, because the mental situation and the challenges you face and life in general changes like hell. I'm not even going to lie. All of that, you have to learn to divide yourself between two human beings, and that's a big toll. But I think that there is some misfit in all of our psyche. I think this is something that is developed for all of us in the exposures that we have had. And also for you, for instance, every day I would stand in front of the mirror and be like, oh, my belly's growing. Has it grown? Oh, it's going to get bigger. And I'm like taking pictures and I'm so excited about it. And everybody's posting this, oh, baby bump, love it, da, 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 all this kind of stuff. And then the moment the baby's out, like everybody's so shy, they cover their belly, they start to tuck things in, pull their pants up high. And you know what? I'm guilty of it too. I also have realized that the C-section delivery rate is so high now in India. This is what my doctor was telling me. And the concept behind getting back our bodies is so far-fetched, because not only is there the physicality of the belly growing and what that looks like, but even the C-section area, your scar, actually losing all of that feeling in that area and causing this sort of like skin overlap, which is the way in which a doctor will work to stitch you back up. You're actually left with this shelf. And me being aesthetically about my body and my business, or at least have been in the past, I struggle with this a lot, having that big shelf that just hangs over. But there are procedures that you can work with to fix that. And I feel like that awareness in India is so little. And there's scar mobilization. There are things where you can actually play with the skin and teach that layer of skin to build back its connectivity so that it has reaction, so that it can start to develop and regenerate, which is incredible. Because when I left the hospital, I was told none of this, right? Especially for a C-section recovery. It's like telling somebody who's had a knee surgery, right, that, you know what, you'll bounce back in like a few weeks, don't worry, and here's your report card and bye. No, they prescribe physio, they prescribe crutches, they tell you you can't walk, you can't whatever. With a C-section, like, they don't tell you much other than don't lift anything heavier than your child, you can't do stairs, and come back for a dressing change after 10 days. Like, literally, that was what I was told. It's a serious abdominal surgery that has a lot of impact on our mobility as well as our mental well-being, you know? So there's all of this postpartum stuff that isn't really talked about or shared. And I, for one, have come to this realization that, you know what, Zoe, I am not who I was. I'm not that psychotic freak with the six-pack that I had all the time. I'm now a mom with 2 kids with limited time, but lots of knowledge. And I want to share as much as I can with that physical aspect of people's lives to how to get it functioning correctly, so that you can then build it back to what you were doing. It's more about what we were doing and what we were capable of, rather than how we looked